Hi all, welcome back to Drona and this is Dr. Jishnu Narayanan. We were discussing about the eczema, atopic dermatitis and related clinical conditions in the previous sessions. In this session, we will be dealing more about understanding the samprapti of the eczema, how to make a protocol in the clinical scenario to treat eczema, and briefly about few of the formulations and medicines what we use in clinical practice to treat the eczema successfully. So let's see what we are having here. In the last part of the same series, we have gone through the clinical presentation of atopic dermatitis, other varieties of eczema, and how we can assess the involvement of dosha and dusha in the eczema. So the importance of tridosha in eczema, among them the importance of pitta, involvement of rasa, rakta and mamsa as dushyas, the dushi visha concept, and the kulaja variety or the involvement of kulaja bhava in eczema. All these has to be kept in the background before we go into a prescription or before we plan our treatment methodology. So similarly, these are few theoretical aspects which should be in the background of the mind before we start our assessment and before we start our prescription. So we won't be going in depth with these factors, but we have learned them in our earlier period of the academy, and it becomes again a very important basic point. Here, coming into the diagnosis of the samprati, even though we have gone through which dosha and dusha are involved, but again, in which state that dosha is there and in which state the dusha is there and whether the ama and niramata are there or not, this becomes an important factor to understand the stage of the disease which we are dealing, and accordingly, the treatment has to be planned. So, mainly, we can see 5 aspects of the samprapti. One is whether the ama is there, and if it is there, whether it is sarvadeha pravisrita, whether it is all spread all over the body or not. So that is an important factor. For that, you have to see the symptoms like jara, gaurava, shitata, pinasa, running nose, rhinitis. So mild temperature throughout the body, rise of temperature in the evening, night fever, all these factors becomes an important tool to understand the sarvadeha pravisrita ama or sarvadeha pravisrita sama dosha. Second one is, if not on sarvadeha pravisrita, whether there is ama in the koshta or not. So for koshta, symptoms like aruchi, avipaka, and malabadha, utklesha, ajirna, pratilomata, all these conditions, all these symptoms becomes an important tool to understand the koshtagada ama. And if ama is not there in the koshta, still it's not nirama, whether ama is associated with the kushta in the localized area of affected kushta. So kushtagata sama dosha, whether there is a sama avastha in the kushta. So it becomes a bit tricky to understand whether there is an samata in the kushta, but symptoms like shula, srava, shobha, all these, guruta, all these comes as a tool to understand the sama dosha in the kushta. So the whether it is a sama or nirama, and if it is sama, where that sama is located, whether it is sarvadeha pravisrita, koshta or kushta, that becomes an important factor. And if it is nirama, then doshaja kushta lakshanas, paitika kushta lakshana, vadaja, kabhaja, which we have seen in the earlier part, becomes an important, and along with that, the dhatu, which dhatu or dosha is involved. So these 5 factors becomes an important baseline to come to a plan of the treatment, and understanding this becomes the diagnosis of the samprapti or the stage of the eczema. So if it is sarvadeha pravisrita, we understood that with the symptoms what we have discussed now, then the treatment modality mostly will be mrudulanghana. So Shodhana is mostly contraindicated in sarvadeha pravisrita ama. We have to make it niramavastha by mrudulanghana. We can use techniques like upavasa or pachana, and the medicines which is ruksha, shita, and pitta, which is pitta kabhara in nature, Lekhu, all these can be used. And for instead of Kashaya or very Guru kind of medicines, Toya Kalpanas or Guligas, Rasa preparations or Panaka kind of Lekhu Aushadhas can be incorporated in our treatment modality. So these are few of the examples which we use in our clinical practice for the ama in the Sarvadeha Pravisrada, for the Pachana of the Samavastha. So Shadangam becomes an important Kashaya yoga. Pachanamadam is another Kashaya yoga. So these are few examples what we are talking about. There can be multiple medicines which we can use, where the yoga is almost similar with 1, 2, 3, 4 varieties of medicines similar in both the yogas, and other few are different. So you can see here the difference. Shadangam is mostly more Pittahara in nature, and Pachanamradam is bit more Pitta Kabhara in nature. So we can select the medicine according to which dosha is in Samavastha. So there is more very varieties of Shadangam which we can prepare. We can prepare Amrita Shadangam with adding Amrita into that. We can prepare Nishundi Shadangam, which if we want to make it more Pittahara in nature. So Shundi is the only drug, Nagara is the only drug here which is bit of Ushna. So even we can remove that, and instead of Nagara we can include Amrita. So these are all interesting techniques to make a medicine more suitable, more personalized to the condition. Or we can use, if it is more Pitta Kabhara in nature, we can use Pachanamardam, which is the combination you can see here. The yoga like Sudarshanam tablet or Sudarshanam Churna, all these can be a drug of choice if the ama is Sarvadeha Pravisarga in Kushta basically, or in eczema. And if it is in Koshtagada, the ama is in Koshta, the symptoms we have seen already, Pachana and Sramsana will be a option. So for the Pachana in Koshtagada ama, we can use actually the same medicines what we have discussed. And for Sramsana, drugs like Aragodha or Amrdottaram Kashayam, Tribhala, Brihat Tribhala practically act as a Sramsara Dravya, and we can use it to remove the excessive ama present in the Koshta. And Shadharanam kind of yogas, these all can be used to make the effect of Sramsana if Koshtagada ama is there. And if the ama is present over the Kushta, the dosha lakshanas are there, but it is Sama dosha lakshana. And if there is no involvement of ama in the Koshta or Sarvadeha Pravisarda, again ama harana has to be done, ama pachana has to be done. It might be a bit tricky or difficult to understand whether it is a Kabha Pradhana Kushta or a Sama Kushta, but by experience we can make it out by looking into the Kleda Avastha, looking into the Srava Avastha, the Shula. All this becomes important factor to understand the Sama dosha in Kushta. So here the drug should be Kledahara, it should be Pitta Kabhara in nature, it should be Tikta Pradhana, Ruksha Laghu Aushadas should be selected. And Aushadha can be selected specific to which Dushya is involved. If it is more Rasa involvement, then the Aushadha can be selected accordingly. So all these tricks can be tried out in the clinic. So here you can see the here you can see the Sama Kushta Lakshana, and here you can see the Niramada or slightly reduced ama. You can see the difference here. Similarly, here also you can see the difference. So, as we were discussing, you can choose the drugs accordingly. If it is a Pitta Pradhana Sama in Kushta, so drugs like Guruchari or Gopichandanadi will be handy. And if it is associated more with Rasa. And if it is Rakta association, again Pitta, the drug of choice can be different. Or these are few examples through which we can actually understand how we can incorporate the different yogas, different formulations according to the dosha and according to the rasa, the dhatu. So if it is mamsa and pitta involved, drugs like Panchatiktakam or Chandraprabha will be handy. And almost similar, Panchatiktaka, Chandraprabha or Kaishora Gugulu will be handy if it is Mamsa Pradhana Kapha. And Shadharanam will be handy in Kapha Pradhana and associated with rasa. So these kind of combination we can find out with the theoretical background to make our prescription more precise and effective. If there is no involvement of ama, we have seen all the sama nirama lakshanas, and if we are sure that there is no involvement of samata in the kushta, then the dosha pachana should be done, and for that specific kushtahara dravyas or kushtahara yogas can be incorporated. So there are multiple yogas which we use. If the dosha is prabhuta avastha, if it is too much of dosha is involved and the symptoms are very much, we can go for shodhana if ama is not there. And if it is a alpa kushta, then pachana can be incorporated. So for shodhana, you can see all these drugs like padola muladi yoga. It is available in churna, it is available in kashaya or mani bhadra churna. It's not lehya what we are talking, it's not rasayana what we are talking, but the churna of the mani bhadra, which we can prepare, and it is very effective when used as churna, as a shodhana dravya in amavastha, niramavastha, sorry. And drugs like avipatti or nimbamrdadi eranda in specific conditions where we are sure that it is completely a vada pradhana kushta. So all these options can be tried out. These are few yogas which we use, starting from Lodra Sevyadi, which is explained for Luta Visha in Ashtanga Hridaya, which is a very specific Pitta Hara yoga, to Kulakadi, which is an infective, used usually in infective kind of eczema, with Chobagini as one of the main ingredient, which we can consider as a drug of choice in Tridosha Pradhana infective eczema. And here you can see few yogas and options for Kapha Pradhana Kushta in the last, like Nishottamadi, Vajragam, etc. So from Pitta, you can slowly come down to see the Amrita Rajanyadi, Manjishtadi kind of Pitta Kabhahara yogas, Shonidamridam Maragudhadi kind of Kabha Pitta Hara yogas, Gugulu preparations and Nishottamadi kind of more Kabha Vada Hara yogas like Vajragam, and completely Kabha Pradhana Kabhahara yogas like Kulagadi, Pradoshahara yogas like that. It can be the individual effect of these yogas can be assessed and can be used in the treatment of eczema. So these are few other yogas like Makipuvadi or Koshatakyadi Yavagu, which are not directly told for eczema or skin condition, but as eczema or atopic dermatitis is almost identically, or what to say, almost seen along with the involvement of Koshtha. These drugs which we use to increase the Agni, which we use to treat the Koshtagata Vyadis, all this becomes very, very handy in some cases of atopic dermatitis. So for external treatment, Shalana is one of the major important treatment what we can use even in acute or in the chronic conditions of the eczema. And all these drugs, specifically Karaskara, Pupilu, Guduji, and Aragudha, becomes a very important drug even in the very acute conditions of eczema. Again, drugs or the methods like Takradhara or Shastikashali Lepa or Shastikashali Dhara, all these can be incorporated in specific stages where we need Rukshana, we can use Takradhara, where we need more Snigdha Pradhana therapies, we can use Shastikashali Lepa or even Dhara, where the skin, dryness of the skin and the issues with the itching, all these can be taken care of, and more stable kind of remission can be expected. After the treatment, the Rasayana Prayoga becomes an important factor, and these are few examples of effective Rasayana yogas in atopic dermatitis and other kinds of eczema. Guduji and Bhringaraja as a common single drugs, we can use it as a preventive or Rasayana yoga in specifically in atopic dermatitis. So researches have been done, and it becomes very effective, specifically when there is involvement of Shwasa and Koshta Vyadhis. This becomes an important yoga. Vrishagrida, when there is association of asthma and atopic dermatitis, it becomes an important yoga. So Tiktakam and Mahatiktakam, of course, is effective. And Manibhadra Gulam, here we can use it as a rasayana in a larger quantity after proper shodhana. So to conclude, the aspects of treatment, usually it is about controlling the itching. So patient just need to control their itch. That is their important need. So that has to be taken care of. And managing and controlling the dry skin, we can adopt whatever methods we want, just like the Shashtakashali Leba or the Dhara kind of stuff. But the aim of the treatment should include managing and controlling the dry skin. And skin inflammation has to be reduced. For that, we can use lifestyle changes, we can use different methods of medicines, etc. But the aim is to reduce the skin inflammation, promote healing, prevent the infection. Secondary infections are very common, and it is one of the most common cause for triggers. So that has to be taken care of. So, and flare-up should be prevented. So these are few treatment aims which we should be keeping in our mind before we again come up with some prescription. This was an attempt to understand eczema briefly in Ayurvedic perspective. There is always a chance to elaborate all the points what we have discussed in this series. Let's learn together. Thank you for supporting. Keep watching. Thank you.